Good morning, good afternoon, everyone. I'm Susanna Sirkin, Director of Policy at Physicians for Human Rights. Thank you for joining us today to mark this somber but significant anniversary. 10 years ago, Syrians across the country went out into the streets of their cities and towns to call for basic human rights, for participation in their government, for equality, for freedom of expression and political opinion. They were met with the most brutal persecution, with the dictatorship of Bashar al-Assad and his allies inflicting a decade of violence and brutality, constituting crimes against humanity against their own people. As we at PHR know all too well, the Syrian government launched years of attacks on health facilities and personnel as a strategy of war. It is important to pause today to acknowledge the victims, the courageous first responders, the extraordinary efforts by so many, in so many ways, and in so many places to document the decade of crimes, and to imagine the way toward a just peace with accountability and human rights for the people of Syria. We will start today's session with a short video that we prepared to mark this day. And now I'm deeply honored to introduce our moderator, my friend, longtime mentor, intrepid human rights investigator, teacher to generations of human rights practitioners and advocates around the world, founder and leader of pioneering non-governmental organizations, historian, analyst, editor, writer, emergency doctor, public health expert, former PHR board member and current PHR Advisory Council member, Dr. Jennifer Leaning. In addition to all that, Dr. Leaning is Senior Research Fellow at the FXB Center for Health and Human Rights at Harvard University and Associate Professor of Emergency Medicine at Harvard Medical School. And together with panelist today, Samer Jabbour, and with Iman Nouahid, she co-chairs the Lancet Commission on the war in Syria. Jennifer will present our wonderful panelists and moderate our conversation. Over to you, Jennifer.
Susanna, thank you for that lovely introduction. And as you know better than anybody, much of what I've learned about human rights is from you. So this is a mutual encounter of respect. So I would like to say something about this this overall issue of this war in Syria. That over the years that I have studied war and conflict, and many of those have included human rights investigations supported by PHR. It's become apparent to me that the cumulative effects of war on civilians should be categorized as the burden of war. And amplified by our discussions on this Lancet Commission, we are really beginning to zone in on this concept to try to alert the world, the safe and happy world, as compared to what is happening in Syria, to the extraordinary awfulness of what war does to life, and particularly what I'd like to underscore, what it does to the future of those who survive the kinetic effects. This concept, the burden of war, talks to the massive burden on life and possibility. It helps us to capture how war crushes most things important to living creatures and deforms our landscape in bewildering ways. Tanks sit on farmland and hills. Burnt out jeeps litter the sides of the roads. The fields are filled with rubble, bomb fragments, unexploded ordnance. Wherever you look, the world is filled with the detritus of war, and it's empty. This is particularly true of Syria. It's empty of the people you knew and loved. Issues of disability are dismissed in the kinetics of war, and mourning is not given space. But these immense burdens surface later, and the motivation for what to do on all survivors is sapped by the overwhelming sense of disarray and ugliness, not just in visual terms, but what the war has revealed about people, the mistrust, the violence, the fear. Jeopardy now haunts the cities of Syria because this is where Assad's forces still hold sway. This life feels unreal to those who survive, and these distortions last for generations. There is no clear human rights document to talk about obliteration of the future. So while it is not difficult to talk about the public health ramifications of the burden of war, it is difficult from a human rights perspective. And that's why the work of PHR is so phenomenally important. It has traced the annihilation of the pinnacles of Syrian society. And here I'm speaking about the physicians and healthcare workers and the hospitals and the health clinics. These were treasured aspects of Syrian civilization in the 20th century, and they are now gone. It is also the fact that, as PHR has documented, it has laid siege to settled areas, obliterated entire cities. It has wantonly hit populations with chemical weapons attacks. It has caused tens of thousands to disappear into the maw of its prisons and security apparatus. There is no longer trusted authority in Syria. The government is the perpetrator and the enemy. And so these sustained assaults on civilians and civilian assets and on normal life in general comprise a deadly and powerful component of the burden of war. And we are going to hear from 4 Syrians, each with remarkable experiences, to talk about how this war in Syria has affected them personally and how it has driven them to define a new life, a new trajectory, a new career in an effort to retain their sanity and to help make sense of this war to others in their world, in their country, and in the forced diaspora of the refugees. So it's really an honor for me to introduce our panelists, and I will do so in the order in which they will speak. Our first one is Hussam Al-Nahas, MD, MPH. He's the Middle East, Africa and response to the crisis in Syria as a volunteer and also as an emergency physician in Eastern Aleppo. He has a number of things that he's going to talk about that relate to his firsthand experience in a very vivid way. Our next panelist is Zahed Katurji, known as Hamza. He's a Syrian doctor, founded Al-Quds Hospital in 2012, in the early days of the war, and an emergency doctor who wound up being almost entirely responsible for the entire population of the city of Eastern Aleppo as the war moved on. He's featured in the Oscar-nominated documentary For Sama, which is directed by his wife. He is currently a public health candidate, Master's of Public Health candidate at the London School of Hygiene and Tropical Medicine. Our third speaker is Aula Abbara. She is a consultant in infectious diseases and internal medicine at Imperial College Healthcare Trust in London, an honorary clinical senior lecturer and a professor of global health at Imperial College London. She's the co-chair of the Syria Public Health Network and has served as collaborator on the Lancet Commission on Syria. And then our fourth speaker is Samer Jabbour. He is a practicing cardiologist, a professor of the Faculty of Health Sciences at the American University of Beirut, and a member of PHR's Advisory Council. He is also co-chair, along with me and Iman Nawahid, of the Lancet Commission on the War in Syria. He previously served in the Department of Non-Communicable Disease and Mental Health at the WHO Eastern Mediterranean Regional Office. So these are seasoned, skilled, and amazing veterans of this war, survivors in the best sense of the word. I look forward to having them speak in the first section of this panel on their personal experiences with the war and getting out of the extreme jeopardy that they were all facing. So could we begin now with Hussam? Would you like to start? Thank you.
Thank you very much, Jennifer. Thank you for this introduction. I have to quickly say how much grateful I am for you personally, for what you did to me and the thing that you taught me during my time at FXB Center for Health and Human Rights 3 years ago. I think this is what showed me the light and really made me that immersed in the field of health and human rights. So thank you very much for the great work you have been doing. So as you mentioned, for me, when the Syrian revolution started in 2011, I was a medical student who only wanted to graduate and start practicing. But then when started witnessing the horrible crimes that were committed against protesters, and then the denial of their access to safe healthcare and the detention even from the beds of the hospitals, that changed my mind and moved me toward working more on providing health services and helping people who were unable to access healthcare. What made that change to me as a person from, again, being a medical student to be an activist during the Syrian revolution is when we established our clandestine team that were aiming only toward helping people during demonstrations in Aleppo. And when tragically 3 of our team members were detained to be sent 15 days after detention, tortured to death, with their nails extracted, with their teeth extracted, and then burned, just for them to be a message to us that this will be the fate of any physician, any doctor, anyone at all who tries to help and help protesters or demonstrators. The other turning point was for me when I was detained myself in Aleppo. And I keep recall when I was tortured under detention and only asked about my role as a physician, only asked about other physicians who were working with me in the same team, only asked about who I treated, how do I get medical supplies to help people. And that to me was really remarkable and important when I recognize myself as being treated as if I'm an enemy to the state, enemy to the government, while what I was doing indeed is helping my people. And then when I moved back, when I was released from the prison and moved back to my hometown in Damascus, I still remember when my mom put the knife between my hand and her chest, and asked me to kill her before leaving back to Aleppo, because she knew that she was sending me and that I was trying to go to a death trap simply by working in a hospital. Not to carry weapon, not to fight on the front line, but purely to deliver health services. And I think this speaks about it all. And I believe what we saw after that was way much horrible. My work on on documenting chemical attacks and preparing for chemical attacks, the work on documentation and really helping to bring perpetrators of international crimes and war crimes to justice has been my work since then.
We will now turn to Dr. Katurji, best known as Hamza, for his account of his personal experiences.
Yes, thank you very much, Jennifer and all. I must say that I'm very, maybe this is the first panel that I'm really stressed about, because being now a public health master student with all of you in this panel. I've been since before I sleep yesterday, I was just saying don't say a lot of people, say the vast majority of people. This is how it should be go. So I'm very honored to be with you. For me, I guess the story kind of not very different than Hussam. I must say that most of the medical students in our age were just their main goals was graduate, leave the country, work outside in the Gulf, to practice in the US, UK, Germany. It was a very clear kind of streamline for us just to leave the country. We never felt like we belong to Syria. We never felt that we have any stake in our own country. And after the revolution started in March 2011, and after I participated in the first demonstration, that wasn't straight away from the beginning, maybe it was in May or June. And the first chant of freedom and democracy, we really felt something change in all of us. We stopped talking about leaving the country. We're talking about what to do, how to make this successful, how to participate more to really make the change in Syria. And we know that the government gonna meet us with the maximum brutality. But that was what they have done, crossing so many red lines that was beyond our expectations. The word silence and lack of accountability for a decade of the war crimes that committed in Syria was another shock. I graduated from medical school and moved to East Aleppo, where I start working in several small first aid points, and then moved to Al-Quds Hospital and start working there with the team that I was working with before. We were roughly about 5 to 6 people, just trained, 2 trained nurses, 1 midwife, and myself, that we started the hospital. And then by 2016, the staff was about 110 working in East Aleppo in that hospital. Al-Quds Hospital was then the last remaining hospital in the sieged East Aleppo after the Syrian government and the Russian allies has destroyed 9 out of the 10 hospitals in the city. And we were in a way or the other responsible for the whole population. What I want to just kind of talk about what this kind of 4 to 5 years working in a conflict area, it opened my eyes about the concept of public health, which it wasn't very familiar in Syria, and I guess a lot of also other countries in the world. that like how like healthcare is not only about individuals. Healthcare is about like the community, how kind of like working for the community health will have like more would be have like better effect than just treating individuals. To be honest, my mother still asks me like, if like, are you going now to finish this master and go to work in a clinic and a hospital? And I really struggle to explain like, not really, but you're still gonna be proud of me. I'm not like gonna cheating my MD. And really, I guess like that's what meant a lot of Syrians doctors moved to the public health. And that's also like highlight kind of the feeling of the belonging to the community more and want to deliver more to the community. And that's what like the Syrian revolution started and enlightened us all to do.
Thank you. Thank you very much. And now we will turn to our third colleague, Aula. Could you recount the ways in which the war, the kinetic war, affected you, and what you have done with that as part of your life?
So thank you very much. So of course, my experience of the conflict has been tremendously different from that experienced by Hamza and Hussam, who have lived it day in, day out, under bombardment, working in the most catastrophic of circumstances where justice, accountability has gone out the window. And so for me, I have the privilege of having been born in the UK. My family is from Homs. We're from Reef Homs in a town called Hula. And actually that's very important because Homs was among the hardest hit of the cities early in the conflict. And then more particularly on the 25th of May, 2012, there was a horrific massacre of the many massacres that Syrians have experienced across the country, which occurred in the town that my family come from. And I remember that night very clearly. And I'm going to be honest and say, I didn't take it very seriously. My mother was intermittently calling me because when she wasn't on the phone to me, she was on the phone to her family who were in the process of moving to the next town to get away from the Shabiha. And I didn't take it seriously because this certainly wasn't the first horror that we had heard coming out of Syria. And I didn't realize quite the extent of how tremendously, and I'm using the word horrific a lot, but there's no word that describes what happened that night. And in that one night, 108 people were killed. The majority of them were women and children, and the majority of them were slaughtered in the most vile of circumstances. And so for me, what that did more and more was galvanize my, I was going to say my desire, but really it was my duty to step up and work, whether it was as a clinician, as an advocate, in any way possible to support, whether it was my family or other Syrians or other health workers working in Syria. And so after that, I had the opportunity to volunteer as a clinician on the Turkey-Syria border with the excellent British organisation called Hand in Hand for Aid and Development. And then subsequently to that, I realised that I couldn't just keep going in my annual leave. I wanted to do more. And so I took a year out of my training. At that time, I was training in infectious diseases. And unlike many of the Syrian healthcare workers, not only Hamza and Hussam, but the many tens of thousands of others who've had their training interrupted for what we all know is a vocation. It's not just a job. I was able to continue my infectious diseases training. But in that 12 months out of training, I was able to volunteer with Syrian refugees in Jordan and in Turkey. And that wasn't only as a clinician, but also as an educator. So of course, I'm passionate about infectious diseases. Conflict is catastrophic for many things. And now we see with the COVID-19 pandemic, it destroys every single aspect of a health system. And for a health system already affected by conflict, the consequences are unimaginable. And so subsequent to this, I was able to continue to work as a clinician, including subsequently for the Syrian American Medical Society in response to the refugee crisis in Greece, but also ongoing in Jordan and Turkey. And so for me, what the conflict has meant was, rather than feeling rather hopeless in another country while knowing that Syrians were suffering day in, day out, and it's not just Syrians in Syria, it's any single refugee who's out of the country for whom the trauma and the horror is non-ending, I was able to contribute in the ways that I had the skills to do. And more recently, that's included engaging with academic work, and I've had the privilege to work with Samir, Jennifer, and others, and learn from experts in this field as part of the Lancet Commission on Syria, but also to co-found with Fuad, Adam Coutts, Miriam Orkut, and others, the Syria Public Health Network, which aims to gather and give impartial conversations around public health in Syria. And then with the COVID-19 pandemic, I was able to support Primary Care International, a UK-based NGO at the end of last year, to support with COVID-19 training and ongoing support for the doctors who remain in Northwest Syria. And the importance of this for me is to show solidarity with the doctors who continue to work in unimaginable circumstances. And I'm going to stop there. So thank you very much.
Thank you, Aula. And now we turn to Samir. Sir, please tell us the immediacy and then your trajectory and impact.
Thank you, Jennifer. It's a privilege to be with the panel and to hear the amazing stories of our colleagues. I will speak from the adding the perspective of a researcher, is that how you deal with a subject like this as a researcher, as an academic who deals with students, in our case, students of public health. Like everyone else in this panel, I was deeply affected. My father, who died in 2016, had a really one big hope, was to return and be buried in Aleppo, and he could not have that. So like the millions of displaced, his stories is one small part of much bigger suffering. Now, that bigger suffering is what we, you and I and Iman and other colleagues in the Commission, Jennifer, are trying to make sense of, to really use your word and make meaning of this suffering. So our purpose was to look at the impact of the war and the conflict on people and through the health lens, but it's not just about documenting violations and the negative effect. It's also recognizing the heroism, recognizing the tremendous humanity that's been there, recognizing the solidarity. But perhaps study that in ways that stay for posterity, so people in future conflicts can make use of it, develop it, and improve it. Now, this is important because if you look at the research on conflict and health, it turns out that the affected communities are really not in the leading roles of studying the impact of their conflict and health, much like you know, it used to be dominated by global institutions who were doing the research, who were leading the humanitarian response. That changed with Syria. People like Hussam and Hamza showed us something differently, showed us how locals can be innovative, can be leaders, and we wanted to do the same. And that's why in this background, I have this Faculty of Health Sciences, where we decided that for this particular war, we want to really spend our energy learning from the inside, as people deeply affected who live in protracted situations of conflict instability. The background to this is that Lebanon had experienced 15 years of civil war, but did not really come up with a historical memory of the civil war and health. And we wanted to do something different for Syria, and that's how we came up to launch the Lancet AUB Commission on Syria. Now, we obviously did not want to stop that, so we started actually teaching our students in our faculty a new course. We started on armed conflict and public health that just not look only at Syria, but looked at conflict in our region and in our world. Now, I will build on the world, because this is really what it comes down to. We've lost Syria. Our communities have been broken. Our hopes have been shattered. But we cannot lose what Syria represents to the world. Both in terms of positive aspect that you spoke about earlier, the record of his civilization, but also what the conflict in Syria, it essentially speaks about the terrible moment in our world today. The evil pragmatism, the turning the eye to rampant violations of international law, limited solidarity, all of that. So we cannot afford that. And I'm not just speaking as a Syrian, I'm speaking as a member of this world. You know, this is the only world we have. COVID came again to emphasize how interdependent our realities are. And through the example of Syria and the tremendous work that the PHR has done, we hope that we can work together towards a better world. Over.
Thank you. Thank you very much. Now we have a break into another part of this panel. I'm going to be asking you to keep your remarks to about 2 minutes each, because we're going to have some time, I hope, to discuss between and among us, all right? But what we would like to do now is return to the lineup, and each of you now speak. So beginning with Hussam, each of you now speak more technically and precisely about either what you did during the war or what you have been doing now as it relates to the war. So we'll get a sense of your professional evolution and the ways in which you have actually contributed to general knowledge in very important ways. Hamza in particular, you're going to be talking, I think, about just the logistics of doing healthcare and how that system-wide problem, I put system in quotes, really has enhanced your understanding of what you want to do next. So that's going to be the pivot. 2 points for each of you. And could we begin, Hussam, with you?
Thank you very much, Jennifer. Maybe I'm going to start by elaborating more on what Dr. Samer mentioned about writing the historic memory of the Syrian uprising and really honoring those healthcare providers who lost their lives fighting for people, fighting to fulfill their duties. And I think this is really was my intention. This is how I was approaching the future, and this is how I worked during my time being involved in the Syrian conflict. I really worked hard to be a key witness. And I think this is the role of a lot of all physicians who are working in Syria. Being a key witness that document the horrible war crimes and violations to human rights that were committed inside Syria. We know, unfortunately, justice is still far from being achieved, but it's our duty. It's an obligation to really document what was happening. Again, as I mentioned earlier, I worked as an individual, maybe crazy indeed, considered, on documenting few chemical attacks that were committed by the Syrian government. And actually the evidences that I was able to collect were used by OPCW to confirm the use of chemical weapons and then point fingers to the perpetrators. And this is an achievement. Again, even before joining PHR in 2014, I keep remembering how I was seeing the map that PHR developed at that time, and I hope we can see it on the screen now. where it tracked the attacks on healthcare facilities one by one through the timeline. Like when I was working in Aleppo, when I was tracking the news from Aleppo, I was able to see what was happening on time in this map. So as you can see in this map, there was around 595 attacks being documented since 2011 and until today. More than 500 were committed by the Syrian government or its allies. If we go further toward speaking about the killed healthcare personnel, I mentioned that killing 3 of our team members, Basil, Musab, and Hazem, was a remarkable change in how I was involved in the work during the revolution. And you can see also on PHR's website that more than 930 healthcare professionals were killed. 90% of them were killed by the Syrian government. And again, the work should continue, and we all have the duty to continue documenting these atrocities, these war crimes, so we can hold perpetrators in the future accountable for what they did as an essential step for any future peace in Syria and Syrian people.
Hussam, thank you. I know it's difficult for all of you to compress very complex ideas into 2 minutes. You did it very successfully. The map helped, and this is a challenge you now face in this panel, to do exactly what Hussam did. 2 minutes, dense stuff. Okay, because I know you have it in you. So Hamza, could you speak now, with the specifics of what actually you did during this time and how that's made you think about systems in public health?
So before doing that, I would like to show a video from a quick clip from the Film Action for Sana that will show you the inside of the hospital in Aleppo and what does it mean to be in a hospital in Aleppo. So I'll be great to see that.
سما سما مرحبا يا ماما، صباح الخير. شو يضرب كتير اليوم؟ وإذا بس ما ضربنا نحن حبيبي ولك سما لا 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 سما الأمور صارت كتير سيئة هلأ. بوكي مداوم كل الوقت بالمشفى، لهيك نحن عايشين هون هلأ. هاي غرفتنا. هدول اللوحات مخبين وراهم الدشم يلي بيحمونا من القصف. نعم روحي. عم نعمل جهدنا لنحس كأنه بيتنا. شو ببلش هلا؟ مروة إبراهيم عملوا عليك ريورد صامين، مروة إبراهيم عملوا ريورد صامين. في إسعاف، لازم أنزل لتحت.
I wanted to show this clip. It's not like I don't want to show like the mess of the emergency room and like the body packed or injured packed on the floor and like the corridors of the hospital, which you can expect in a war zone. So I want to show like the hospital settings we were working at, the decision of physicians that we really need to be at the hospital 24/7, being on call all the time, that I had really to move my family there inside the hospital, which is, by the way, the most dangerous place in a conflict area regarding like in the Syrian situation. We had a joke in Aleppo that the front lines are more safe place than being in a hospital. And because like hospitals were the basic target for the Syrian regime and its allies, which like the Physician for Human Rights map show clearly. And being like a hospital manager has, like in any part of the world, has its own challenges. But being in a war zone, when each decision may cost a life, so the decision basically of, shall I like share the coordinates of the hospital with the WHO in order for like the confliction mechanism to take place, and they're going to share it with the Russian. Shall I share this and then the hospital be bombed and then I'll be kind of like responsible of that? Or shall I not share it and then the hospital gonna be bombed and being blamed because I didn't share it? Like, shall I like the location of the hospital, putting the sandbags, negotiation with the NGOs to get the fund for those sandbags because they consider it as construction, while the fund they have is only for healthcare, and like they have specific lines, budget lines for that, and they don't pay for construction. While basically like keeping the hospital location safe is the first thing in providing healthcare. And it's, I really can't talk for days on that. And like you warned us very clearly, like to keep it into 2 minutes. And but like that's the main thing. And like, during the siege, the same thing happened, like with like zero availability for like medical supplies to get in. You can't like refer any patient outside of the city or even inside the city because the movement itself is a risk. And like there's so much conversation can be talked about the WHO response, the Security Council response toward that like still no one has been accounted for, like the siege of Aleppo, the attack of 9 hospitals in east part of the city, and all the other war crimes that were committed. I guess like this is kind of the incitements I just like really want to draw in these 2 minutes.
Hamza, thank you. We'll have a chance to come back in a moment. So, Aula, please.
So I'm going to be succinct, but I want to highlight maybe 2 or 3 projects I'm currently involved with. And I'd like to highlight them because they have an eye on the future. And the focus of all 3 of them very much relates to the health system. So the first project I'd like to highlight is one done in collaboration with Len Rubinstein and Rohini Ha from Johns Hopkins and Berkeley with R2HC funding. And this is a really fundamental project which I'm involved with on behalf of the Syrian American Medical Society around the public health impact of attacks on healthcare. And we've heard from the excellent work that PHR has done and the other panelists today just how devastating these impacts are. But with my academic colleagues, but also my practitioner colleagues, we want to document this and really highlight exactly what the immediate and longer term impacts of these attacks are. And we're doing that with mixed methods. The other piece of work I wanted to highlight was a recent piece of work that I've done with Samir, Hala, Manar, Karim and others for UN ESQA as part of their NAFS program. And so I do urge you to have a look at their website and keep an eye out for the report. So NAFS is the National Agenda for the Future of Syria. And what we did was an in-depth analysis of Syria's health system, which, as many of you will know, is absolutely fragmented across geographical and political borders. And of course, there's been areas retaken by the government and they are suffering tremendously. And I hope we'll hear from Hussam and others more about that. What I would like to focus on is the recommendations that have come out of this work. And they very much relate to the obvious, rebuilding infrastructure, but also for perhaps the lofty, but certainly things we need to talk about. The things which relate to justice, political commitment, universal health coverage, community-led approaches, really listening to people in the ground across the country. And these are the sorts of things that we would like to be advocating for at different levels over the coming months and years. And the last thing I would like to highlight is this year is the WHO designated Year of the Health and Care Worker. Of course, that's come on the back of the COVID-19 pandemic, but for us as Syrians, it's an opportunity for us to really highlight just how much Syrian healthcare workers have suffered, not just from the conflict, but also now the devastating COVID-19 pandemic, which has killed probably over 150 health workers in government-controlled areas, many of whom themselves have been threatened in the course of their work, even though they don't have adequate protection. Alongside this, with my colleagues from the Syria Public Health Network, we're doing interviews with Syrian healthcare workers in Turkey, Germany, and elsewhere to understand what their experiences have been, how we could have done better for them, and what their future perspectives are. Because as I said earlier, healthcare workers are absolutely fundamental to all parts of Syria's health system. So thank you.
Aula, thank you very much. Important work. Samber, over to you.
Okay, I'll be brief because I know we're running short on time here. I'm actually not going to speak much about our work, but rather our collaboration with PHR. You know, soon after we, as you know, Jennifer, when we launched the Lancet AUB Commission on Syria, we, like others who work on health and the Syrian conflict, you quickly realize that it is PHR that really has the most data on the subject that is the most frontline subject of the Syrian conflict, which is the attacks on health facilities and targeting of health workers. So this led us to develop this concept of weaponization of healthcare, coined by my colleagues Annie Sparrow and Fuad, working with a team of researchers in the commission. And we've elaborated on multiple dimensions of this phenomena, which will be discussed a little bit more in a comment coming up in the Lancet, being published in a couple of days, and later in a report of the commission. Now, this phenomena is really possible to describe thanks to the work of PHR. So we have started a collaboration with PHR in which we actually worked on their databases, and we witness the rigor with which they have approached the documentation of violations, the innovation of using multiple methods, including social media, and the investigation of those violations. We've also clearly seen how PHR has raised the bar and really created a new standard for investigation of health violations in conflict settings. I mean, who would have a record of 10 years, a full decade of investigation, not just through counting, enumerating attacks and deaths, but carrying out in-depth work through their case studies, through their research into the torture, into the health system in Daraa, and all of that. This all speaks for the rigor, and it's a rigor that really tells us all researchers who work in this area of the need to introduce a depth of scientific inquiry into approaching this subject, and use that towards advocacy. This is the approach that they do. Now, PHR advocacy is global, but they have always emphasized through this work, as we have seen and reflected in this panel, the partnership between the global and the local. And this is something I have always appreciated in the PHR's work, and we look forward to continuing the collaboration. Over.
Samer, thank you. We have heard briefly and very succinctly, very dense and wonderful comments and analyses from all four of you. We have very short amount of time. What I would like to do is respond to a question from the chat, which I think speaks to all of you, but I'll ask Hussam very briefly to answer first, and then we'll go to Hamza, then we'll go to Aula, and then we'll go back to Samer, okay? Because it's an interesting question. And you may have very little to say or a lot to say, but realize you can't go more than a minute, okay? Here we go, okay. This question is, what is the situation now in Syria now? Are the attacks and the killings continuing for healthcare workers? Are we talking about a moment that is frozen in time as of 2019, or let's go forward and what's happening now? Okay, so Hussam, and to the extent that either of you or any of you can speak to this, you may not have current information, which is fine, but Hussam, we'll start with you.
So absolutely, the killing and the targeting of healthcare facilities continued during the 2020, although with less frequency comparing to other years. But I think during the COVID-19, it is the time when the Syrian people now are paying the price of this long-term systematic targeting of the health system. We saw from our report from Dar'a the intentional neglect and the obstruction of healthcare to people who are living in areas that were retaken by the government, and how they were punished for being disloyal at one time during the history because of this disloyalty to the government. And I think the northwest and northeast Syria are still struggling to respond to the COVID-19 because of that systematic destruction and the mass flee of the healthcare providers who really left the country because of that targeting that took place throughout the history of the Syrian conflict.
Thank you, Hussam.
Yeah.
Hamza, please.
Yeah, I just want to add on that, like less than a year ago, there was like the massive attack by the Syrian regime and the Russian to recontrol more areas, which reduced to roughly around like 1 million person were internally displaced into camps in Syria, inside Syria. All the areas that the Syrian regime and the Russian has taken over, all the health facilities on those areas were bombed, completely bombed. And basically, so like at the moment, yes, there is no attacks, but that's not because like there is any negotiation or agreements or anything. It's just because at the moment, the Syrian regime and the Russian hasn't decided to launch more attack, which there are so many threats of several parts on northwest Syria to happen. And expected the same tragedy going to happen again since 2012, destroying the health facilities in the area, sieging small pockets, take over, displace the people, more IDPs in the camps, and more refugees trying to go to Turkey, Jordan, Lebanon, and to Europe. That's been like the scenario since 2012 till the moment.
Thank you. No, there's high jeopardy, as we know, in northwest Syria around Idlib. There are at least 2 to 3 million people trapped, and there's no place for them to go because Turkey has closed the border. So this is actually an ugly threat that we are all fearing will evolve into something even more deadly. But as you say, there's jeopardy everywhere. Aula, please. Your comment.
The only thing I'm going to add to this is actually when we think of attacks on healthcare, we often think about direct bombing, but actually there's a bigger attrition. So we must remember that the COVID-19 pandemic has exacerbated personal attacks and vendettas against healthcare workers. I've received anger in my work in the UK for devastated relatives who may feel that we could have done better. And those of you that manage COVID-19 will know sometimes, particularly in the first wave where we didn't have steroids to use, patients could deteriorate. In Syria, it's even worse because they didn't even have enough ventilators or the capacity to use them. So there's been horrific reports of direct attacks almost without accountability against healthcare workers themselves. So please refer to the Syria Public Health Network report, which is in the chat, which Umar Hiraki and others have contributed to, which has such details.
Thanks. Thank you very much, Aula. And Samar, your observations.
We have spoken a lot about the systematic targeting by the Syrian government of health facilities in non-government controlled areas. But in the interest of truth and objectivity, I'd also like to recognize that there are violations against healthcare that are taking place everywhere in Syria. In the northwest of Syria, some of the extremist groups have actually infringed on health rights and medical practice on a regular basis, and we hear this from our colleagues there. In the northeast of the country, there are also discriminatory practices within healthcare and sometimes practiced by a few health practitioners of discriminatory practices based on ethnic grounds and whatnot. So, violations against healthcare continue. What is important to really highlight also right now is that healthcare is going to be an important subject as we move forward in discussions of accountability and pursuit of justice. You know, Ala Musa, a doctor from Syria who was involved in torture in
Samar, thank you. We're coming to a close. I'm sorry. I think that this is a great question. Thank you, Jat, for surfacing it. And we are going to have to leave you now. But I think what this has shown, this set of vignettes of Syria then, now, sense of the future, your introduction to these four valorous, incredibly talented people who are unpacking for me the notion of survivor. And I've had that notion for a long time, should convey to you, the audience, of the intensity of the Syrian experience, its imprint on millions of people, and its implications for all of us, in that this hideous reign and the suppression of people, civilians as well as others, in Syria, and the flight out from Syria, have distorted our worldview of what is possible. It's undermined our sense of whether we could intervene as an international set of organizations to improve the situation or moderate it. We are still not providing much in the way of any substantive support for those who are suffering. We are not protecting them, and the risks ahead remain quite major. So we're talking now at the 10th anniversary to say there has been immense suffering, enormous courage, tremendous life inside and outside, as you can hear from our panelists, but the ongoing jeopardy to a society and a civilization is one that we have to bear witness to with sorrow and recommitment to helping the world end this war in Syria. Thank you for your attention, and it's been a privilege to talk with all of you.